everyone. I'm Tanner Kearns. Welcome to the pod presented by Northwest Health.
I'm Corey Myers. I work in marketing here.
We have
Darcy Yeager. I'm a peer specialist and community health worker, and I also help Robyn Armstrong with a couple grants we have here.
And I'm Robyn Armstrong, also with Northwest Health Services. I'm a licensed social worker, and my primary role is manage a behavioral health grant and an opioid response grant that we have, and Darcy and I work together on that.
Yeah, which is why we've invited you today, because mental health, which is what this episode is about, is a very, very, very big thing and topic right now, especially in the United States. Of course, all over the world, people deal with mental health problems, but I just noticed seeing it more and more and more. And especially since the pandemic, too.
Yes.
I think the mental health, what would you call it, like field?
Yeah, the mental health field, or some people refer to it now as the behavioral health field.
Okay. Well, it's changed drastically and is changing, I feel like, as we talk. And every day there's something different. I know we sit in on meetings now and try to think of ways to recruit mental health providers.
Yes.
And
absolutely.
It's like, and you guys work heavily with these grant programs that tackle a lot of mental health topics and things. So
I just recently went to the Missouri Rural Healthcare Association. They had a workforce development conference, and one of the speakers called it a double whammy. What she meant by that was people just have additional stressors that they didn't have. Some of it's COVID related, some of it's not. And then at the same time, we have a tremendous workforce shortage for mental health professionals. So it's like we have twice the need and half the staff that we need. And they said really for every one person that's working in the mental health field, there are 2 jobs open.
really,
So
I believe it.
Yeah,
Yes.
I do too.
yes,
I mean, we're seeing that firsthand here at Northwest.
we are.
We have several mental health provider openings and struggling to recruit those providers. And that's what I was referring to earlier. We've had like 4 or 5 Zoom meetings now on recruiting mental health providers. And,
Right.
you know, I don't want to say that you feel like hopeless that there's none out there, but it does seem like they're harder to find.
They are. And I think one of the things that Missouri has done, which I think is very positive, is I think a lot of people are trying to respond creatively with this crisis. And so that's a little bit where Darcy comes in. There have been new certifications presented that we know there are people that have lived experience with either substance use or mental health who are tremendous helpers. Sometimes people respond better to somebody that's going through or has been through what they're dealing with better than, a licensed therapist that went to school 6 or 7 years. I'd like Darcy, if you're open to that, what I'm talking about, Darcy's just been employed with Northwest a few months, but she really hit the ground running. She's got her peer support specialist certification, her community health worker certification. And so that's what's happening. We're recognizing that not everybody needs a licensed therapist to improve the quality of their life. There are so many people out there that can be great helpers. So I'd like you, Darcy, just to kind of share a little bit about your background personally and what led you to do what you're doing now.
Yeah, well, we want to hear it.
Yeah, so I have struggled with mental health since about middle school is when it started. I started with anxiety, and it slowly turned into depression and anxiety. But what was the hardest part, I think, was my mom not realizing that depression is an actual thing and that it affects so many people, because she just thought it was an anxiety. She goes, "Oh, you just get nervous when you take a test or whatever." I'm like, no, like there's so much more, like I'm struggling and I'm sad and for no reason. And then Robyn, I got better and got the help I needed and the right medication. And Robyn brought this job opportunity to me, and I had never even heard of a peer specialist before. And so, yeah, for people who do struggle and have got the right help, a peer specialist is a great opportunity because the mental health field is so scarce right now with employees, you know.
Mm-hmm.
So
How does someone become a peer specialist?
there's a week-long training, I'm pretty sure is a week, and it's pretty intensive, and it's over Zoom right now, I think. Well, it was for me anyways, with COVID and everything.
Mm-hmm.
I took mine in this past November, so November of 2022, and it was a great learning experience. I learned a lot through it, and yeah.
And the other requirement for a peer sports specialist is you have to have lived experience.
Yes.
That is really the uniqueness of it.
Yeah.
And, you guys know I'm doing a lot of work right now with schools because youth is a target population of this behavioral health grant that we have through HRSA. And so working with a lot of schools and some of the partners that we have, we have a consortium of partners that we've built that share the same goals that we do, that we're working together. And we're finding that peer support services in the schools, they are really finding as much, if not more, success with the kids than actual therapy services. Not to say anything negative about therapy services. They're just a different service.
Yeah.
I
mean, it makes sense because if I was going to go get counseling or seek help from somebody, I think seeing a professional counselor would be a good thing. But at the same time, if I could find somebody like you who was going through something or had been through something similar that I was going through, I would rather talk to them because at the end of the day, experience wins over everything in pretty much any category of life.
Yes.
I mean, so that makes perfect sense.
Yeah,
For sure.
Absolutely.
When I first started out in therapy, my first therapist was like a 60-year-old man, and like we just did not connect at all. And
Yeah.
I just think if I had a peer support specialist when I was going through my toughest time, that it would have helped tremendously.
Yeah, I mean, if you could have had somebody close in your age, another female even, or I mean, that doesn't really matter technically, but you connect with people that you're alike more, and
Yeah, for sure.
I'm sure that would have been more helpful to you than just also seeing a regular counselor. Not diminishing what counselors do, but yeah, the peer support specialist program seems like a more great fit for helping those people.
Absolutely.
And
Definitely
it's
for
easier.
helping youth, I think.
Yeah, and it seems easier to obtain that credentialing than it would be going to school to become a social worker or a counselor. It's faster.
Absolutely. Really, there's no formal education required to be a peer support specialist. Darcy had to put in an application. I had to agree to proctor your test, didn't I? Was that for the peer support or the community health?
Yeah, so I had to fill out like an application and tell my story and everything, and for me to be accepted into the program to be trained. And then, you went through a week-long training, and then you have a test at the end of the training. And, Robyn had to proctor my exam and pass that, so.
And there is a fee to get your certification. Do you remember what it was?
I think it was $75.
And then is there a requirement for continuing education for the peer support, or was that just for the community health worker?
I think there is.
There's some continuing education, but it's very doable. I mean, and there are so many people out there that are just naturally good helpers because of what they've been through, but people don't know that this even exists.
Yeah.
So, and there are agencies out there that are hiring peer support workers.
Because of the low amount of providers? Or?
Yes, absolutely. And just, they're just finding, the evidence is showing that it's it's very beneficial, very
Yeah.
helpful. And like I said, therapy is not for everyone. Therapy has its place, but sometimes you just have somebody going through, maybe they don't typically have depression or anxiety or a mental health diagnosis, but maybe they're just going through a crisis in their life. Something's changed. They have additional stress. Maybe they lack support. Some people just need some support and some guidance and just somebody to listen. They just need some crisis intervention to get them over that hump.
Yeah.
And then there are people, though, that struggle really throughout their life with depression or anxiety, whether it's life situations or whether it's just a chemical imbalance in our brain. And so medication can help significantly with that, and therapy can help significantly with that. So there are definitely different levels of helpers out there. One of the goals that Darcy and I have is to, I'm working with schools, we're working with schools, and occasionally a school counselor will reach out and say, hey, I have this kiddo. They're kind of interested in psychology. They don't really know what direction to go, what kind of education they need, what they can do. So we know that there are all kinds of people out there that could be helpers. They just don't know enough about it. So we're kind of in the process of partnering with high schools in our Northwest Health coverage area, also community colleges in our area, four-year colleges, and then of course we have this partnership with University Health in Kansas City. And so we're kind of on a mission to plan some sort of event. We hope to do it in the next year and get all of the people at the table, because there's community mental health centers, in our coverage area. They're struggling to find a workforce. So I feel like we are going to have to build our own army in Northwest Missouri. And I know that we can do it. There's a lot of compassionate and passionate, people in Northwest Missouri that want to work on this. And so I feel like we're going to see some progress with this.
Absolutely.
Yeah. Okay.
So yeah, I think the peer specialist program that we've been talking about is really good, and it's like a hidden key to help with some of the mental health crisis that we're having. And I think it's cool too that it's only a week that
For sure,
that it
yeah.
takes to get the credentialing. So can anybody get that credentialing if they want? I mean, like, I know that you said there's an application, but can anybody off the street just fill out an application and they approve you, or is there still some kind of like check and balance?
Yeah, as far as I know, all you have to do is fill out the application, and then it goes through a review process, and
And then you have to have the experience
Yeah.
of some kind.
You have to have some lived experience. Yes.
So when you give that experience, do they like put you in a category of like, this person went through X, Y, and Z, so they would be a better fit for Joe over here?
No.
Oh, okay.
And it's kind of weird. It's mixed with the substance abuse part. So people who have gone through substance abuse and problems with that, they're in there too in that training.
Mm-hmm.
And those are peer support specialists too.
Yeah.
So it doesn't necessarily have to do with mental health.
Right.
So
Yeah, because we met the guy that came and talked at one of the lunches you guys
Yes.
put on in Chillicothe, and he had become a peer support specialist for
Yes.
Yep.
that was his experience, but
Yes, that was Dusty Slimp, and
Yeah.
he is a peer support person, and he's doing work in schools up in I think Atchison, Holt County area,
Oh, cool.
and yeah, absolutely. So I think they definitely look at how long have you been in recovery. I mean, if somebody just went through substance use treatment and a month treatment, I mean they're looking at generally a couple years maybe. Where you feel like you have been in recovery. You know what, though? I mean, even people that have been in recovery for years sometimes can have challenges come up.
Yeah.
I was talking with someone one day, and he said some of the best help that he had was someone that had been through substance use themselves, and they were helping him, supporting him. And he said, and then they had a relapse. And he said, and everybody around him was like, oh my gosh, how are they going to help you? They had a relapse. And he said to me, that was the best thing that could have happened to me, because I watched them relapse, and then I watched them get back up on their feet and get back into treatment and get back into recovery. And he said, that's the best thing that could have happened to me. So,
Right.
Yeah.
I mean, we're humans. Everybody's human.
Absolutely.
Everybody has their challenges, their stressors, and recovery is a lifelong effort. It's a lifelong journey.
Yeah,
Whether it's substance use or mental health, it can be a lifelong.
it probably showed
journey,
him that
yeah.
this isn't fake. Like, I still struggle too, even though I'm a peer support specialist, and everybody needs help. You know, I mean, I don't think, and this is just my personal opinion, so it's not fact or anything, but I don't think anybody like ever is 100% healthy as far as mental health goes, like ever,
Yeah,
which is very interesting to think about.
I mean,
but-
we all have our ups and our downs, and we're never going to be all the way up all the time. So, you know, I see it as a roller coaster. You know, I have good days, and I have bad days, and, you know, it's just
Absolutely.
trying
Yeah.
to balance and
That's a good way to put it.
figure it out.
It's similar to physical health. You're not always going to feel 100% all the time.
No.
Nope.
You know, you might wake up one day with a headache, you know, or you might wake up one day feeling very depressed. And
Yep.
sometimes you don't know why either.
and that's all very normal. Sometimes, just in my career at least, I've had people say, "Well, how do I know if I'm depressed, or how do I know if this is just a bad day and I just need a little support, or how do I know if I need professional help?" And really, what you need to look at is, I mean, are you having more good days than bad days? Or are you finding, like, over the last couple weeks that just almost every day feels like a really bad day? The other thing to look at is it affecting your functioning? You know, whether that might be in your relationship with your spouse, your role as a parent, your role as an employee. Is it affecting your daily functioning? And if it is, those are situations that might require some more professional help. And there's
Yeah.
absolutely nothing wrong with that. Most of us in our lifetime will have an episode of depression or anxiety, and it just needs to be normalized because it is normal.
100%.
There's like the term quarter life crisis, midlife crisis. I've heard that thrown around a lot, where you live a certain amount of your life and then things change, whether you graduate college, you don't know what to do, or you get into your 40s and you don't know what to do.
Right,
and,
right.
Or your kids have grown up and you're like, it's always that life-changing event. Like for me, it was becoming a parent a couple years ago. And that, like, threw a whole wrench in the cog. It was like, oh my gosh.
Your life is never the same.
My life has not been the same since we had our daughter, and, you know, I won't go into many details, but even there's days where, like, maybe I'm not feeling 100%, and then I go home, and I don't want that to translate to my kids, but at the same time, I also don't want to be fake in
Right.
front of them all the time either.
Yeah.
So I've had to, like, figure out that balance quite a bit. But mental health is just a beast. I
It
mean,
really is.
and I always tell people, and I think I've told Robyn this, it's just like an infection, like a zombie apocalypse or something that just doesn't stop spreading. And yeah, I don't know if it's like necessarily spreading like an infection, but everybody's dealing with it, and coming out of a pandemic has not helped anybody.
No.
Exactly.
Yeah.
And I think we worked with our consortium to choose our target population with this behavioral health grant to be youth, because I think our youth they're in mental health crisis more than
Yeah.
they've ever
Absolutely.
been. I personally, and this is just a personal thing, I personally feel that our smartphones and social media have contributed just so greatly to
Yeah.
that. And so that's one of the reasons we chose our target population. And we have a goal of not just reaching those kids that we know need professional help, but at some point educating and supporting all kids and teaching them just about wellness. We all just need to know about what wellness and what that looks like, and the different ways that we can try to achieve it. So that's also a goal that we have with our rural school, districts in our
this-
Northwest coverage area.
This is the grant program for people that might be listening. You mentioned earlier that Northwest has a grant that funds different initiatives like this, and it's focused on the rural communities of Northwest Missouri. That's what you keep referring to.
Yes, we call it RCORP, and that stands for Rural Community Opioid Response Program. So a few years ago, because we know we also are in an opioid crisis that's an epidemic. And so that's the first grant that we got, and we're at the tail end of that grant, but then we just got this RCORP behavioral health grant with really an emphasis on behavioral health, but still also with an emphasis on addressing the opioid crisis, because we know that substance use and mental health are just so interrelated. And so you can't really address one without addressing the other. So when we're talking about RCORP, that is this grant through HRSA, which is the Health Resource Service Administration. It's the federal government, and they have trusted us with some grant funding to try to help with the goals of the grant. And so we're trying to one of the big things is just, about equity. And some people, when you say equity, they think that means treating people equally. And that's not necessarily what health equity is. I like to use the example, if you've got a couple kids, they go to a baseball game and there's a big fence up and they're trying to watch the game over the fence. And you've got a tall kid and a short kid. You don't give them both the same size ladder, because the tall kid doesn't need as tall of a ladder.
Right.
And that may seem like a silly example, but that's really what health equity is not everybody has the same opportunities. I know there are people out there that believe in the United States everyone has equal opportunities. I don't personally or professionally believe that. There are absolutely inequities in all kinds of places in our life, but healthcare as well. So we're really trying to find places and situations and people that lack the most access to services that they need.
Yeah.
Some services are so much more accessible to groups of people than other groups of people. And so we're really looking at that, trying to break down barriers, improve access. If it's okay, I wanted to talk a little about our new mobile unit.
Yeah,
because that is something that we are trying to utilize to improve access. So
yeah, I was going to say, what are some of the things that you guys have already done with the grant program this year? Maybe you could share a few things that we've already done, but also some things that you're working on.
Absolutely. So if you're not familiar with harm reduction are efforts to... Oh gosh. An example of harm reduction is when you're crossing the road with your child and you tell them to look both ways, okay? A car might come by, but you definitely want to minimize any risk factors, and that's kind of what harm reduction is. We have to meet people where they're at. If people are using substances and they're not ready or they're not choosing not to use substances, we need to try to find ways to help them. And meet them where they're at. So we have done a lot of distributing of naloxone, also known as Narcan. We have the nasal spray, and that is to reverse an opioid overdose. So what we've done with our consortium, and I'm going to let you talk about our texting line here in just a second, Darcy, but we in the last year have been able to get probably over 300 personal carry kits out to different counties in our coverage area, to law enforcement, to just
firefighters,
agents. Yes, yes.
They've been using them for trainings and all kinds of stuff.
Exactly. And we've had some Narcan trainings, and a story that I think is a very positive thing. A college student came to one of our trainings, our Narcan trainings, and we distribute a personal carry kit with the Narcan so that they have it on them, and provide some training. And a few weeks after that happened, that college student's instructor reached out to me and said, can we get some more Narcan for her? She said her brother had an overdose and the Narcan was used, and it did save his life.
Oh, wow.
That's great.
But it's going to be a few weeks before they can actually get him into a treatment program, and she's concerned he might have another overdose.
Do it again, yeah.
So we immediately got some more Narcan to her. So those are the things we're trying to do. We just want to save lives.
Yeah, because it's not going away. And I think with Narcan, that's a big misconception sometimes, is that you're encouraging these people to overdose more. But you're not, because they're going to do it anyway.
Absolutely. And people don't want to use drugs to want to use drugs. They are addicted. They
Yeah.
are physically and psychologically addiction. It's an addiction, and it's such a strong addiction. We were talking about Dusty Slimp being a peer support, and I have a cousin, Ian Thudium, and I know he'd be very comfortable with me sharing his name. In Brookfield, that's where Darcy and I live. And he's had to use Narcan on friends. And if they'd had an overdose, him or Dusty, and they hadn't made it, the world would be missing something right now, because they are helping people. Ian is a very active volunteer in the Brookfield area, does a lot of community service. And so, I mean, people that can have an overdose, it can be our teenage children that go to a party and somebody just hands them a pill and they take it, and it's laced with fentanyl.
Yeah.
And they can be gone within minutes. So
that seems to be happening quite a bit.
yes.
Yeah.
So
I know someone personally that they were at a party and they went to smoke marijuana and it was laced with meth. So,
Wow.
yeah.
Yeah, and it's like they don't know.
Yeah.
yeah. So I mean, our children are. It's not just those people that are using drugs. There's still such a stigma. I mean, this
Yeah.
can happen to any of our children. I mean,
Yep.
it can happen to anybody. It can happen to the person that has an injury and gets surgery and needs pain medication, and before you know it, you're physically and
addicted.
psychologically addicted.
Yeah.
And so it can happen to
I
anybody.
had a really bad ear infection this last week, and like one of the worst ones I've ever had. And normally I don't go to the doctor for those because I usually can get over it on my own. But this one was bad enough that I had to go see a doctor at our clinic, and they put me on pain medication. And I was thinking about that before the podcast today because I knew we'd probably talk about it at some point. But even that, like taking a heavier pain medication for me, somebody that doesn't normally take medication at all, you know, it helped my ear infection, of course, but I just felt like great the whole time
Right.
I was on this medication. And I'm like, I could see how somebody would get addicted to that, where every day they wake up and they're like, well, I can just take these pills and I'll feel great.
Right, exactly. I mean, really, if you think about it, we all kind of have a substance of choice. Mine is sugar.
Yeah.
you
yeah.
know?
Yeah.
So, you know, I think that there are things that we're all human beings.
Yeah.
And I think where the stigma comes from sometimes is when we just devalue human beings.
Mm-hmm.
You know, we're all human beings.
Because everybody makes mistakes. I mean, we're all creatures of habit, too.
Yes.
Absolutely.
And, like, there's just all these things that you have access to that could harm you or they can help you. That seems to be like a common theme, I think, with mental health is the things of the world can either help you or harm you. Like, social media is hurting kids and helping them.
Yes.
And
Yeah.
like phones are hurting and helping.
Yes, so-
and drugs are hurting and helping.
Yes.
Like the list goes on. So it's all about how you're choosing to utilize those things.
Yeah, it's like how, like, because with the bus, you touched on that, and that was out in a rural area, and kids were getting on the bus, and they were seeing please correct me, I don't remember the name.
It's a University Health.
Yes, and so a person from University Health is talking to these kids. We're using the internet, we're using computers, phones to connect with these professionals for these children, but it's like, don't be on your phone so much because it's bad, but we're going to use all the same technology for you to get help.
Exactly.
So
Exactly.
it's
Yeah,
how you
it's-
use the items.
It's the access and how they're choosing to use it, and maybe that means that parents aren't involved in their life like they should be, or you know what I mean, to be there to control those situations for them. And it's just interesting.
Yeah, it is.
That's why we're here talking about it. I mean,
Yes.
this podcast could help somebody,
Absolutely.
but if they can get access on their phone, you know what I
Right.
mean, then this would be something good and useful for somebody to listen to, I hope.
Right.
But they could also find something on the internet about how to make this drug and that could kill them, you know?
Exactly.
So
I wanted to let Darcy talk to you about our Narcan texting line.
Yeah, for sure.
Because it's one thing to get Narcan in the hands of law enforcement and EMS people, but it's another thing to get it in the hands of family members who have loved ones that are using or friends. And so we created this text line, and I'm going to let you talk about it because you're kind of managing that right now. And I'll grab my phone so we can at least give the number. For listeners.
We can throw it on the screen for you.
Okay, that'd be
if
great.
You want, yeah.
That'd be
Yeah,
great.
That's
so
easier.
we just asked people to text Narcan to
To the number that we're putting on the screen
Yes.
right now.
Right.
and
Actually, could you pull it up on your phone?
Yes.
We have people that'll just be listening to audio, so maybe it will be good to...
I can pull it up.
Tanner's got us. Yeah, I mean, I don't have the number memorized yet.
I bet I'm going to get it before you do.
You
Tanner.
probably are, because
It's a race.
here I am, still scrolling. Okay. Wait, no, that's not
Maybe we
right.
should compare our numbers. Make sure we do. Make sure we're giving the correct information. So, if you are in a rural county in Northwest Missouri, and because this is funded with grant funds and it is a rural grant, it does not include Buchanan or Andrew County. But if you are in another county in Northwest Missouri and you text the word Narcan, just Narcan, if you will text that to 660-242-8605, Darcy and I will get that message from you, and Darcy will, within 48 hours.
Yep.
Yes. We just ask for an address. We've had a couple people that weren't comfortable giving their name, and that's perfectly fine. We just ask for an address, and we send it to resident at that address.
Yeah.
And so we're getting that out. And we just started this in March, and I feel like we've had, what have we had, maybe 12 to 15?
yeah, probably 12 to 15.
That's not bad. I
No.
mean, considering that it's just for the rural
Yep.
communities and, you know, the word hasn't quite spread yet.
Exactly.
And
So-
we'll cut a clip from this podcast and throw it out there too.
Okay. That would be great.
Yeah.
We just want to save lives. We want to save lives.
Yeah.
And
So you give them a little sample, or not a sample, but a bottle of
We give
Narcan.
them two personal or
Two
two
doses?
doses. Yeah, 2 doses of the Narcan.
So they can administer it twice if they needed to.
yes,
Is that what that
because
means?
some people do require more than one dose.
Okay,
They may
gotcha.
have a dose, and a minute or two may go by, and they're still not becoming more responsive, and they may require another dose. So
Yeah.
that's typically why we do send 2 doses.
Okay.
And we also, when we send it, there's an information packet in there that says this is where you can go to watch a video on how to administer
That's
it. And
great.
it's very simple, but if you haven't gone through it, it can be intimidating. I know when I first came in contact with this, I was like, oh, I don't have any idea about that. I mean, I've learned a lot.
Yeah.
So we try to also put a resource list in there for people. So if they themselves or loved ones or friends are looking for resources, we also include that in the mailing. That when we send the Narcan. So
Yeah, and it's kind of like a little almost like allergy spray that you squirt up your nose. It's kind of similar looking to that.
yeah, it's very simple to use.
Are you guys, I know you were mentioned maybe doing vending machines down the road. Is that still part of the plan? Or?
It is part of the plan. One of the 2 grants that we have, we're just waiting on a budget. We made some budget revisions, and we're waiting on an approval. And then we do plan to get 1 or 2 vending machines to have Narcan in. And we're also looking at just some boxes that can be put out in the community. We're thinking of places where if somebody needed it at 1 o'clock in the morning, they could get to it. Maybe
Right.
it's a convenience store, maybe it's a motel lobby. So we definitely have plans. We want Narcan to be out there. We want it to be accessible to people because it is a very proven, easy way to save a life.
And Narcan does not hurt anybody, right? Like, Because there's that misconception that if you give it to somebody that maybe is not overdosing on accident, it's going to hurt them. But that's not the case, right?
That's not the case. And the other thing, Narcan is just for opioids, so it won't have a positive response with certain drugs. But anything that is considered an opioid, it would.
Right.
So if you have it and you suspect somebody might have an overdose, maybe they're laying on the floor, maybe they have some history, their skin's purple, they're not breathing right, they're not very alert, give it, because it will not hurt them. It may not help them, but it definitely will not hurt them.
Yeah, especially if you know they have a history with opioids, then
Yes.
It's always
definitely.
worth a shot.
Absolutely.
Literally.
Yes. So I wanted to go back to the mobile unit.
Yeah,
'cause
so
that's some
we have
exciting stuff.
Yeah, the mobile health unit that Northwest got this last year from the same grant program, and yeah, so it's parked in Chillicothe right now, and you guys have been using it at the Gallatin School for some telehealth counseling.
Yes.
So what else are you planning to do?
Well, I did just want to, and you can share, you were at Gallatin more helping the kids get on the Zoom meetings and off the Zoom meetings, but I wanted to share that Gallatin program. It was the first year we'd done it. We're calling it a pilot project. There were lots of stumbling blocks, usually around scheduling, because if you had a parent coming in to meet with the child, you're trying to schedule the child with a school schedule and their parent, and then we had the provider at University Health, their schedule, and then we had to schedule it on a day that Darcy and I were going to be there. So it was difficult, but really by the end of the year, what we had served at least 15 kids and had about 180 counseling sessions throughout the school year.
That's awesome.
That's amazing.
Yeah, and getting really positive feedback from the kids.
Yeah.
Did you have any of the kids share with you how it impacted them?
Not really. I asked some of the kids when they came out of their sessions, like, do you think this is helping you, blah, blah, blah. And a lot of them said that they thought it was helping them tremendously.
Well, that's great.
Yeah.
Yeah, and the school counselors have said to us, we're noticing that these kids that are being seen, they're coming in our office less often with crises, or when they're coming in, it's a less severe of a. So they were feeling like the services were helpful.
How old were these kids?
We had kids all the way from kindergarten to 12th grade.
Wow.
That's great.
It's
Yes.
crazy to think that a kindergartner
Yeah.
needs counseling, but
It's like so true. And I think that starting at such a young age and like getting exposed to talking to a counselor. I mean, I didn't know what a counselor was until, I was at least older.
they didn't talk about this stuff when we were in school.
And I think
very
that's
much.
that's great that we're starting at such a young age to offer a service to these kids, because it's like, okay, I've went through this, I've gotten help, I've talked to people, I can, continue talking to people when I need help.
Yes.
And it's just, I don't know, it makes for better coping down the road, I think.
Absolutely.
Yeah.
It
for
becomes
sure.
more normal for
Yeah.
them.
Yeah.
We're like our generation growing up. Tanner and I are not that old,
Yeah.
but we're old. We're getting there. And we've been out of school for a little bit now.
10 years.
And how you feeling about that? But they didn't really talk about it that much. I remember most of the stuff that they talked about when I was in school was the school counselor, but it was like if you went to the school counselor, it was a negative thing.
Yeah.
Yeah.
It
Like you were
was-
in trouble if you were going to see the counselor or if you were going to the juvenile office.
Right.
Yeah. It was
Right.
there was such a stigma, and I know there still is a stigma, and we're still working through that. But I think I didn't know what anxiety was until I was literally in college. So I always just thought I was nervous, like kind of like Darcy, like your mom said, like, sometimes when you don't physically see something, like say I have a rash on my arm,
Yep.
we physically see that, and it's like there is something wrong and we need to treat it. But it's like with anxiety and depression, those signs aren't always right in front of you.
Yeah.
So I think this is great that we're starting with kids in elementary school all the way up to high school is great as well. But, really starting younger
You guys did that program for the whole school year, or was it a semester?
We got it started at the very end of October. Since it was something brand new, there was a lot of planning that had to go into it. So we started about the end of October, and we are planning on going back to Gallatin School next year. They're excited to have us. We're excited to go. So we felt the year overall, although we had some things to address and things you didn't look for, and you had to regroup. We feel like overall it was really a good success. And I think the school counselors and Dr. Justin Collins, the superintendent, he actually called me last night just to say thank you for coming to our school and providing this service for our students. And so that's been a really, really good thing. So we'll definitely have the mobile unit back at Gallatin School. Something else we're planning to do, I think there is a back-to-school bazaar at Gallatin in the park. I believe it's August 3rd, I believe. So we're going to plan to take the mobile unit to that, maybe offer some screenings for kids. And other things that we already have planned. And Tanner, tell them what we have planned. It's September.
Oh, for September,
yes.
Since school will have started by the time this event is happening in September. But we're going to have the bus come to St. Joe. St. Joe is holding their Pride Fest event in September. Yes, September. So we're going to have the bus at the Pride Festival here in St. Joe downtown. And we'll be offering free HIV screenings to anyone who wants them. Screenings are done within 15 minutes, and you get your results.
Yep.
So we're going to use it there.
Yep, that's one of the events. And then June 3rd, Maryville is having a mental health day. I think it's sponsored maybe by Mosaic. And at the hangar in Maryville, it's June 3rd. It's a Saturday from 4 to 8 p.m. So we'll be having the mobile unit there as well and having some mental health resources and just some little giveaways and things we'll have there too. So
cool.
We're making plans for the mobile unit. At some point in time, we do want to possibly offer some MAT services, some medication-assisted treatment for substance use, and try to find some locations in our coverage area that are really lacking access to those services. So that is absolutely also a goal that we have for this mobile unit. We're a work in progress.
Yeah, absolutely. It sounds like you guys are staying really busy.
We are.
I mean, I kind of know how busy you guys have been, but
it's a good busy though.
Sure.
So if somebody's interested in having us come with the bus to do something, do they reach out to you?
I would say probably reach out to me. Yes.
Okay.
I mean, there's other people within our organization that I'm working with, and we're having meetings and trying to plan, but I would probably be the point person.
Yeah, okay.
Probably for that.
And for anybody listening, you can visit our website, nwhealth-services.org. There's a contact tab. Just fill that out and say, you want to talk about the mobile bus and partnering on an event or something like that, and we'll get it over to Robyn.
Yeah.
Yep.
So, yeah, we had a bus before the pandemic, actually. For a couple years, and we're doing a lot of outreach and things like that. And then all the flooding happened. Mm-hmm. So we were doing a lot of stuff with that. Unfortunately, that bus broke down. Had to get rid of it. It was an older bus that had been around for 20 years probably in the community. But with the new grant, we were able to get a new one. This one's a little smaller, which is actually probably a good thing.
Yes.
Right.
Because those things can be hard to maintenance and take care of, and then you have to have a CDL.
Yeah, it is. It is small, but it has 2 separate treatment rooms in it that you can shut the door. You have privacy.
Yes.
So it is just super, super nice.
Yeah,
We're so fortunate to have
new.
it.
They built it out in Ohio.
Yes.
And then drove it all the way here. The day they delivered it, we had the drone. I might insert some drone footage for the people watching the podcast. They can see the bus the first time we saw it anyway, pretty much.
Yeah, that would be really cool to do.
It was raining that day.
It was.
Because I had the drone in the sky, and I was, it started pouring down rain. I was like, it's probably not a good thing.
It was raining that day.
And then I almost flew into a power line.
Yeah.
We'll talk about that.
Yeah, we won't talk about that. Cut that.
Cut. No. But yeah, the bus is awesome. I think there are some pictures of it on our social media for anybody that wants to check it out.
Yes.
But yeah, the bus is brand new, and it will be helpful to all the communities that we serve.
Yeah.
What are some other things you guys are working on? with the grant? I know you got the Narcan text line, the bus, the pilot program with the school. I know you've got community meetings that you're having monthly or
every other month. We have partner meetings. So the grant required us to have partnerships with community members that could help us with these goals. So we have a few different counties that we go and we have meetings, and just a lot of good people. There's a variety of people from hospitals, law enforcement, EMS, schools, just a good variety of people that are out there trying to help, trying to make a difference. And so we have those every other month, and those have been going very well. The other thing that we're doing that we haven't talked a lot about is prevention. So part of what we're doing in the behavioral health grant is trying to do some prevention. One of the things I wanted to mention, because I just think it was such a success, we had John Morello we offered the assembly actually to every school in our Northwest coverage area, and we had 22 schools that wanted to have an assembly. John Morello does a one-man show called Dirt, and he doesn't present, he doesn't lecture. It is like a play. It's like a kind of a theater production, but he's a one-man show, and he goes in and out of different characters. And I have some of the comments I wanted to share. Let me grab this.
Yeah, pull them up. Well, let's talk about it. So these assemblies were sponsored by Northwest Health through this grant program, and this guy came to these rural schools. He was here for like a week?
2 weeks.
2 weeks?
He came, and I had him scheduled. Most of those days he was here, he was scheduled with 2 schools, one in the morning, one in the afternoon. So he was driving all over Northwest Missouri.
He was staying busy.
And I wanted to just share some of the comments from some of the teachers and some of the kids at the different schools. This was a comment from a school administrator. John's performance was wonderful. Our students were engaged the entire time. Teachers were crying, compelling, truthful, raw, with a message that is so needed. It touched me very much. Positive comments from staff and students. Thank you so much for using grant money for this. Otherwise, all of these small schools would have missed this opportunity. And it's one thing to get that from the teachers and the staff, but these are a couple things that some kids shared. They sent these messages to John after his presentation. And his presentation, I didn't mention this, but it was very focused on a variety of things: mental health, bullying, living in poverty, substance use, suicidal thoughts. I mean, he touched on all those things. And these are some comments from some of the schools that they sent to John. Hi, I'm a freshman from, I won't mention the school. I just wanted to let you know that you impacted both mine and my peers' way of seeing not only ourselves but each other. After you left, it felt as if I went to an entirely different school. I just wanted to say thank you because you truly do help put things into perspective that we all needed to be reminded of. Here's another kiddo. They mentioned their school and their age, but they said, I really connected with your story. I'm a 16-year-old girl that has been through some tough shit. When I was 14, I had overdosed on fentanyl, and I have lost family to overdosing too. Thank you for coming to our school and speaking your mind. So we just had so many comments from kids, and I talked with John. Poor John, he had to have been exhausted after those 2 weeks.
I was going to say,
sure.
So, like a full tour
yes.
for him.
So when I checked with him after he got home and kind of got rested up a little bit, I wanted to share this comment that he texted me. Let me pull this up real quick.
And where is he from?
Gosh, out of state.
Massachusetts.
Was it Massachusetts?
I was going to say, I think it was the East Coast.
I think that's, yes.
So for him to come all the way here was a big deal for these kids.
Yes, yes, it was. I got to share this comment with you because it was just powerful to me. So he said, I've definitely felt like the work that you and I are doing together is making a huge difference, like literally changing the trajectory of lives and getting kids into therapy and getting real help. I will take with me the faces and smiles and tears of the kids I've met after the shows. I'll not only remember them, but continue to advocate for them because there is no them. Only us.
Yep.
So
That's a good comment right there.
he loved Northwest Missouri. He even talked about, I might want to move up here. He was just he loved being up here
Yeah.
and I think he grew up in a small town. So just that small town feel that he just, and the peace that you get in a small town that you don't
Yeah.
necessarily get in an urban area, I think he really appreciated that. So we're really hopeful to look at our budget and bring him back maybe this fall
Yeah.
to some schools that maybe hadn't
Gotten
an assembly
Yeah.
but might want one. So that was a big prevention thing that we did. Tell them about our kindness challenge that we did for this month, May Mental Health Month, with some of the schools, Darcy.
Okay, so Robin ordered, how many cards did you order?
Oh, 17,000.
Just 17,000.
17,000. And we sent them out to schools, and the cards had little motivational sayings on them. And the challenge was you take 5 from the counselor and give them to people.
Mm-hmm.
And whether that be your friend, a teacher, your role model, whoever. And then you're entered into the contest to win AirPods or gift cards.
There you go.
And
Just for sharing some kind words.
Yeah.
Yes.
And if they emailed me,
I need like 1,000 of those cards. I need to wear some new AirPods.
if they emailed me how it went, then they got entered in to the contest again.
Oh, cool.
So
Yeah,
Awesome.
and I think we have 328 entries into the contest.
Oh
Yeah,
my
Wow.
goodness.
And
Yep.
11 schools participated.
That's awesome.
And some of the kids that emailed Darcy just talked about, one of them said, I gave a card to my bus driver. Like, he always tells us, hey, have a great day. And nobody ever says anything back to him.
Aw.
Yeah.
And so some of the kids, they're used to communicating on social media, texting, not having that personal contact. Well, I'm 51 years old, so I'm very old school. So that's why I got the cards. I'm like,
Yeah.
that's what we would have done when we were kids. You passed notes. You didn't,
And this
So-
this generation kind of needs tools like that to encourage
and some
more face to
yes,
face.
and some of them said how much they liked it. One girl gave one to, I think she left it in her mom's purse or in her mom's car or something, and her mom called her after she found it and said, I was having an absolutely horrible day. This just meant the world to me, and was tearful. And so, I mean, the kids really took it and ran with it, maybe more than I thought they would.
Yeah.
And the teachers and the staff were, saying
That's
this
awesome.
was a good
That's
thing for our
such
kids.
a great turnout.
Yeah.
We need to do that everywhere.
Yes,
Yeah.
exactly. Well,
I
I have
mean-
plenty of cards, so
We could handle, a quarter of this area probably with all the cards.
For
yes,
sure.
exactly.
Just send them our way. Well, Tanner and I can think of
Yeah.
a contest. Yeah, that's great though. I mean, I kind of do that with my kids. I leave them written messages. Taya, she's the only one that can, she can't read, but
She kind of knows.
she kind of knows. But she can talk and
Yeah.
understand what we're saying now. So every now and then I'll leave written messages for her, for my wife to read to her
Yeah.
when I'm gone at work and stuff. So, because I grew up, my parents did something similar where they would leave me written notes. If I wasn't going to see them in the morning or something before school, they would leave me a message. Or even though we had phones, it was just more of like it meant more.
Yeah.
does,
Like it's
yeah.
taking time to like find a pen, find a piece of paper.
It's like getting a
Exactly.
written letter in
Yeah.
the mail today. You're like, wow.
oh, I love getting mail.
it's so excited.
Yeah.
Not
so
just
exciting.
mail, but yeah,
just
I like
the
it.
smallest
Bills.
things can have the largest impacts.
Exactly.
Really.
Yep.
So
I think that's a fantastic thing. You should definitely do more of that. We could do one on our social media page.
There you go.
I don't know how we would make sure people did it, but we just have to
well,
trust
and
them,
with
I
the
guess.
kids, that's what we did. We said if you go in the counselor's office and just sign your name that you have committed to taking 5 cards and giving them. We didn't then try to keep track of whether they did
Yeah.
or they didn't. The fact
you're
that
just
they
trying
went in
to-
and got them told us they were probably going to do something
you're
with
just
it.
Absolutely.
trying to encourage them to do it.
Yeah.
Yeah.
So
I think a lot of adults need that too,
For sure.
myself included.
exactly.
Well, so that's kind of all the stuff you're doing, a summary anyway. Just kind of scratching the surface of what you guys have been doing, because I know you've been really busy, and we mostly communicate via email.
Mhm.
if we don't see you guys in person, but I just think it's good for people to know what we're up to regarding the RCORP grant. And you mentioned earlier the MAT program, the Medication Assisted Treatment Program. That's something we have available at all of our medical clinics, and it's housed out of the Family Medicine building in St. Joseph. But then I know some of the other providers at our rural clinics are getting credentialed, and they can see people through that program and do telehealth back here to St. Joe. So
Exactly.
we've had that for, I think, 4 years now when we got the first grant.
I think the last time I talked to Nicole Pierce, she's our nurse that's kind of managing that overall. She told me we have over 200 patients in the
Wow.
MAP program, so that's benefiting a lot of people, and
Yeah.
Absolutely.
a lot of people out there that have substance use issues and they want help. Those medications can help them tremendously.
And this is taking medications and mixing that with counseling. Is that right?
The counseling is an option. I think, it can be offered in conjunction with the medication. And some people do both. Some people maybe do one or the other.
And it's designed to help people that are addicted to opioids
Yes.
kind of get back on their feet and hopefully get out of that addiction.
Yes. And
Would you say it's the first step to, can it be the first step to somebody getting out of that? I mean,
I think it can be the first step. I think in healthcare, what we're all trying to do is let people enter help wherever they can enter help. You know what I mean?
yeah.
Whether
yeah.
that's talking to your primary care physician, whether that's calling 988 because you're in a crisis.
Yeah, the
and-
988 number, I definitely wanted to talk about that.
Yes.
Because that's the hotline for suicide and mental health crisis. If you're experiencing any bad thoughts or
Yes, it's just
dealing
like
with
911, except it's 988.
and it's designed for mental health things. It used to be a very long number. I'm glad they changed it.
Yeah.
Yes.
It's very short and sweet, and it's easy to remember.
So yeah, we've been doing a lot of advertising for the 988 number this year. I think you can text as
Text
well
or call.
call.
You can text or call. Yes, I was kind of surprised because I went to a training here a while back and they were talking about 988 and really how beneficial it's been and how much it's grown, how many more phone calls they're getting. But I was surprised they were saying that they get a lot more phone calls than text because I thought they might get more text, but they're getting actual people calling
yeah, that
in.
surprises me because I'm like, oh, don't call me. I'll text you.
Right,
Yeah.
right,
Yeah.
right.
But, sometimes, usually 9 times out of 10, it's easier to just voice what you have to say and then typing it out and it
Yes.
taking forever.
I guess it makes sense, when you shorten something like that, that's easy to remember. Everybody knows 911, so 988, it's like, okay, get that in your head. And then if you are experiencing a crisis, most people probably need to talk to somebody right then and there, I'm guessing, and not just virtually.
Yes,
Yeah.
yes.
But that's good that they've had an increased amount of calls. They changed that, was it a year ago?
I feel like it was maybe around July last summer, maybe.
Yeah, it hasn't been a year yet.
And that's a national number, right?
Yes, and they have found the use has increased tremendously.
Yeah.
That's great.
It's just all about awareness. What can we do to make things easier for people to obtain and get the information?
Yeah.
That's why we started this podcast.
Yeah.
Yep.
Exactly.
Because we can sit around the office all day and have these conversations and email back and forth and plan all these things, but at the end of the day, if we're not getting the word out there, people aren't going to know about it.
Yep.
Right.
So, is there anything else you guys want to add before we're done today?
Look at your notes, Robyn.
Oh,
Robyn
gosh.
brought her notes.
I brought my notes.
Hey, they were useful. Not everybody uses their notes. I should have notes, probably.
I think really we covered everything I wanted to. There's some other things we've done with schools. We've gotten mental health stickers and provided them and kindness posters and 988 stress balls. And
Yeah.
so we're trying to get a lot of those things out to address stigma, to help kids know that there is help available. This is how you access it.
I will say, I'll plug that our new Chillicothe clinic.
Yes.
The pharmacy's open, and the medical piece to that clinic is going to be opening this summer. I don't have an exact date on when the provider will be actually seeing patients because they're going through the credentialing process right now. But August 4th, we have already set in stone for like a grand opening party at the clinic. It's a Friday evening, and we're going to be inviting anybody from the community out there to come to the parking lot of the new facility. We're located right next to Lowe's because the address is funky. We won't even get into those details. But if you plug it into GPS, it like doesn't pop up correctly. But we're right next to Lowe's in Chillicothe, and we're going to have a parking lot party. We'll have free food, music, free snow cones. And then we have a 3D chalk artist coming from Denver that we've partnered on kind of, I think, or and encouraging families and kids to come out and check out this 3D mural on the parking lot that he's drawing. It's going to be like an aquarium type ocean theme with dolphins and different fish from the ocean.
I will enjoy that as much as the kids. I'm looking forward to
I'm
it.
excited.
So, get outside, come by and take a picture with it. It's 3D. It'll be cool looking. He's also the same guy is drawing one for an event we're doing on August 2nd here in St. Joe at our dental clinic with free snow cones as well. But the Chillicothe date on August 4th, he's doing a bigger mural out there. And so come by, check it out. We'll be handing out goodies and doing raffle prizes and all kinds of stuff.
Yeah.
So, but that's kind of a cool way to get kids to get outside and be off their devices and be off the Xbox and playing video games and come
For
look
sure.
at like art, and
Yeah.
because we don't get a chance to promote art a whole lot in today's world. So
Exactly.
yeah, we're doing that August 4th. And then there are plans to have a behavioral health provider, I believe, at that clinic. But like I mentioned earlier, finding somebody has been kind of a challenge. So
Yes, we're still working towards that, and like I said, sometimes the progress seems slow, but we're moving in the right direction.
Yep,
Yes, absolutely.
Jinx, you owe me a Coke.
Okay.
Well, that all sounds great. Tanner, you have anything to add?
We already touched on it, but just the 988, really,
Yeah.
that's,
Yes.
anyone experiencing a mental health crisis, just dial 988, text or call, and get help as soon as possible. And then hopefully you can find a provider if you need one.
Yeah.
To talk more.
Yep. Absolutely.
There's always hope. It's
Yes.
just getting through a moment sometimes. It's just getting through that moment. So don't hesitate if you're having a hard time to use that number, because sometime down the road you'll look back at the times that you thought about ending things. You'll look back and you'll be so glad that you didn't.
Yes.
So just hang on. There's help. Things,
and you're not alone.
And you're not
Because
alone.
a lot of people, struggle with some form of mental health problems in their life. So
Absolutely.
It's okay to not be okay.
Absolutely.
there you go. Well, I think that's all the information and questions I had for you guys today. I want to thank you for being on our podcast.
Thank you
Yeah,
for
thanks
having
for
us.
having
This is
us.
the second full episode that we've recorded. And Tanner, you want to try to lead the people today this time around?
I'll try to lead the people out.
A closeout message.
Thank you. You guys, there is something wrong
This
with me
is
today.
fantastic. I love this.
Okay. I did it good last time, I thought. Thank you to everyone for tuning in for this episode of The Pod presented by Northwest Health. Don't forget to subscribe to our YouTube channel, and you can find The Pod on all streaming platforms on
Yes.
your phone.
Apple, Spotify, Google Play, Amazon Music. Type in Northwest Health Services, and it'll pop right up.
Yeah. And don't forget to like us on Facebook to stay up to date with all of these exciting events that we will be having.
A lot of outreach events coming this summer, so stay tuned.
Yay.
Okay.
Thank
Bye.
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 you. Bye.